think the NHS can benefit enormously from increasing availability of personal data and linking those data up. We've known for many years that these data are going to be available on computer systems, but we've really put them to relatively little use. I think one of the big challenges for the UK in particular is better use of hospital data, which is on a diversity of computer systems. We have hospital episode statistics that give us the very, very minimum you need about each hospital admission, but really no detail, and certainly not enough detail to look at outcomes, the reasons why people went into hospital, what happened to them in hospital, what happened to them after they went home. So I think linking up data for the full patient journey, right from primary care through secondary care, back home again, and linking up across the life course as well. So we have babies linked to their mother's records, linked to their education records, linked to their future employment records. You can start to build up a picture that really lets you get new insights into people's lives. It ranges from their own care, their own personal care, right through to how we know what's working and what isn't. And I think what's interesting is that these data really blur the boundary between the two. So if you take an example, we're rolling out 4 new vaccinations in the UK. When people have that vaccination, they want it to be safe, they want it to be effective, and we as clinicians and as managers, we want to know who's getting the vaccine, are the people who need the vaccine getting them. And all these things take data. So some of it is research, some of it is direct care, and some of it's in the middle. And I think people benefit hugely just knowing that they themselves have had a vaccine and that it's safe, but also knowing more about the whole population. So I think there's a new level of benefit there that's in between service delivery and research. I think that's right, and in some ways it's more about being explicit. For example, if you take stroke units and the reorganisation of stroke units in London, just as a simple example, clearly to plan that and to know how many hospital beds we need, how many hospitals we need to provide stroke care, we need to know how many strokes happen in London each year. The only way we know that is by using people's data. Individuals in turn will benefit from that, but the data are at a group population level.